Once again hosting its Crush the Crisis Opioid Take-Back Day. It's an opportunity for people to safely dispose of unused or expired medications. That event is coming up on October 23rd. So Dr. Eric Lung is the Chief Medical Officer from Skyridge Medical Center, one of the hospitals taking part in the event. And Dr. Lung, why are these events just so important and crucial to have in our community?
Well, thank you very much. I'm glad to be here. There are folks that will use medications, particularly opioids, for any sort of reason, such as having surgery or having some pain for any reason. And they don't use all of them. They don't consume all of them. They use a few of the pills, a few of the liquids, and then they just leave them on their shelf. And this really puts people at risk for not only abusing them later on, but they can get into the wrong hands, to be honest. Think about a child, a grandchild, that might get hold of some pills, some extra pills that have been laying around, and then consuming them. And that can be very harmful, if not deadly, to a small child. On the other end of the spectrum, people that might keep medications around as they themselves are getting older may respond differently to medications. People that are more senior may have some confusion at times and accidentally take medications that are sitting on their shelf and then have a dangerous or a fatal outcome from that aspect as well. So it is important to get these medications out of people's homes when they are done using them, and to be able to safely dispose of them. And that's why we're having this Crush the Crisis, is to collect medications, specifically narcotics, but we will take other medications as well, but to get them out of our patients' homes, out of our communities' homes, so they can be safely dealt with.
Right, it's just such an important thing. All the examples you brought up are just so crucial. We know, too, a big part of this event is education. So what do you want people to know about opioid misuse?
Yeah, we do have, in addition to the pandemic with COVID-19, we have an epidemic with narcotics. And this has been increasing for the last couple of decades. A good majority of people that are addicted to narcotics ultimately end up using street narcotics such as heroin, which really is not that much of a stretch. From a medical standpoint, we know that this is the case, but society may not actually realize that. Narcotics are widely prescribed because they are very effective to treat pain. And we've just gotten to a point in society that it's become very accepted that people would take narcotics, but they are very dangerous. And because it can lead to a serious addiction, this is the reason why we want to be judicious in our prescribing of narcotics, be judicious in our use of narcotics in the hospitals, and certainly get them out of the homes.
Right, and are there any warning signs of opioid abuse that people should be looking out for or be aware of?
Yes. Signs of opioid use would be certainly somebody that might have chronic pains, but really any pain for that matter. And when people have too much narcotic on board, they oftentimes are very, very sleepy. They can be confused. They can have slurred speech. They can actually have a lot of nausea. They can be constipated. Those are probably the main reasons or the main symptoms that one might have when people are taking too much narcotic. And this can be anything from heroin to a medication prescribed from a physician. It can slow down their breathing. And this is oftentimes the symptom and the reason why people would overdose on narcotics is that their respiratory rate gets so slow that they're not bringing in enough oxygen to get to their brain, let alone the rest of their body, and people can die.
Yeah, absolutely. Is there anything else about the Take Back event that we haven't talked about that you want our viewers to know about?
Yes, so as I said, we are taking all medications, pills and capsules. The things that we're not looking to collect would be liquids or aerosols, inhalers, needles or syringes. The focus is on narcotic, but we will take all pills because they can be dangerous too if they are in the medicine cabinet. But it is October 23rd, starting at 10 a.m. at Skyridge outside of the emergency department. I'll be there, and we hope that if you have some medications in your cabinet that you're no longer using, please bring them by so we can dispose of them.
Right. Thank you so much, Dr. Lung, for joining us and telling us all about this important event. We really appreciate it.
It's my pleasure. Thank you.
Great. And the Crush the Crisis Opioid Take Back Day again coming up Saturday, October 23rd at 5 Health One hospitals, including Skyridge. For a list of all the locations and more information on that event, you can head over to cbsdenver.com.